In the name of Allah, Bismillahir Rahmanir Rahim. Our topic today will be about auditing of standard of documentation for cleaning and decontamination of transvaginal ultrasound in gynecological ward, retrospective clinical audit. Contents of the topic today, it will include introduction, aim of audit, gold standard, target, results of our clinical audit, recommendations, and finally, take-home message. All of us is aware about HAIS, healthcare acquired infections, infections acquired during process of care. Healthcare acquired infections represent a common serious problem all over the world, in Europe, in United States of America. So if we take the figure, for example, in Europe, 1 in every 18 people will have healthcare acquired infections on a given day. So 80,000 patients have at least one healthcare acquired infection on a given day across Europe. More or less the same figure in United States of America. So it is common serious problem, need our deep and careful attention to prevent it. 33 to 55% of healthcare acquired infections are preventable with persistent evidence-based infection prevention practice. Healthcare acquired infection had a negative impact not only on the patient himself and his quality of life, but also negative impact on the healthcare system and on the community itself. So, any patient admitted to a hospital will have a 5% chance of contracting an healthcare acquired infection. More or less 99,000 people in the United States of America die annually from healthcare acquired infections. Healthcare acquired infection kill more people each year than breast cancer and prostatic cancer combined. If any patient acquired healthcare acquired infection during his admission to the hospital, so his length of stay in the hospital will increase by 17.6 days. And of course, this represents physical, emotional, psychological, financial burden for the patient and his family. Please have a look for the financial cost of healthcare acquired infection in one country as United States of America. In America, 1.7 million people per year get an infection during a hospital stay. 69% or more than two-thirds of healthcare-acquired infections affect people with Medicare or medical aid. 9.4% of total inpatient costs are healthcare-acquired infection-related, and the healthcare system pay every year $35 billion. Healthcare-acquired infections are the infections which acquired during providing healthcare or during hospital admission. I will discuss how the ultrasound machine and ultrasound probe will act as a method of transmission of healthcare-acquired infection from one patient to the another. Here I will discuss how the ultrasound room and the ultrasound probe can work as a source for transmission of infection. For example, of patient A, which is deceased, came for ultrasound room to do ultrasound. If the ultrasound probe was not decontaminated in a proper way, the microorganisms will be transmitted from patient A to cover the surface of ultrasound probe. When patient B, which is healthy means this patient doesn't have health-acquired infection at the moment before the ultrasound. When this patient came or comes to do ultrasound using the same contaminated ultrasound probe, the microorganisms will be transmitted from the surface of this probe to patient B, and the patient B will acquire healthcare-acquired infection. So, the microorganisms was transmitted from patient A to the probe of ultrasound due to lack of decontamination process, and from the ultrasound probe to patient B, and healthcare-acquired infection can occur in this manner. It is important also to mention that healthcare-acquired infections can happen for the patient from the hospital environment. As you know, microorganisms can be present on the surface of the table beside the patient or bed linen or in the curtain. And if these microorganisms transmitted to the patient in absence of infection prevention control guidelines and the absence of infection prevention control practice, the patient will acquire healthcare-acquired infection. If this patient come to the ultrasound room to do ultrasound, and if the probe is not properly decontaminated, the microorganism will be transmitted from this patient to cover the surface of the probe, and from the surface of the probe, it will transmit infection for other patients. Also, it is important to mention that healthcare provider himself may be the source of infection, and he can transmit the infection to the patient either in direct way or indirectly. Indirectly, if this healthcare provider who is infected, for example, deal with ultrasound machine and probe without proper decontamination, the microorganisms will cover the surface of the probe, and from the surface of the probe of ultrasound, it will be transmitted for other patients, and healthcare-acquired infections can occur. So it is serious, vicious circle. Evidence-based infection prevention control is mandatory to stop the spread of healthcare-acquired infection. In many studies in Europe and the United States of America, 23% of Persons who do the scan don't use probe cover for intervention procedure. 12.9% of probes remain contaminated following low level of disinfection, and up to 9% of barrier sheet and condoms leaks due to low quality or poor quality. And all of this represent the importance of follow-up evidence-based methods of ultrasound probe decontamination. Life brings tears, smiles, and memories. The tears dry, the smiles fade, but the memories last forever. That is my old memory book. On your left-hand side, this is the map of Philadelphia in United States of America. On the left-hand side and the photo blue, this is my photo, the smart man. On your right-hand side up, the map of America. And on the lower, this is the city of Philadelphia. I hope everyone can know this is smart, intelligent doctor. It is not my photo, but try to remember who is this doctor. He is American one in Philadelphia, and he did a great job for all the human being. I hope you can remember him. Anyhow, I will tell you later on. The photo I showed you in the memory book, it was for Dr. Early Spalding of Temple University, Philadelphia, Pennsylvania, United States of America, was born 1907 and unfortunately and sadly passed away 1995. In 1939, Dr. Spalding established a categorization system for medical devices based on the risk of infection associated with their use. This classification system has been adopted by United States Food and Drug Administration, FDA, FADA, and the Centers for Disease Control and Prevention, CDC, and is used by many professional medical organizations to choose disinfection or sterilization protocols for various medical devices. Medical devices are divided to one of the three categories. Group 1, non-critical, a device that ordinarily doesn't come in contact with the patient or touches only intact skin, looks like blood pressure cuffs, stethoscope, or abdominal scan on intact skin. These devices should be cleaned as a minimum by low-level disinfection, as a minimum. Semi-critical, a devices that come in contact with intact mucous membrane or with non-intact skin, and these devices need a minimum high level of disinfection. Group 3, critical, a device that enters the normal sterile tissue or the vascular system where blood flows. These devices looks like surgical instrument, needles, intravenous catheters, should undergo sterilization. So, Spalding classification: non-critical, semi-critical, and critical 1. Again, have a look for the macro efficacy of different level of disinfection and how sterilization, high level disinfection, intermediate level disinfection, and low level disinfection can affect the various types of spores, non-enveloped virus, fungi, mycobacteria, bacteria, and virus. Sterilization is highly effective. Low level of disinfection is the lowest effective one. Now come to the most important question in our topic. Is ultrasound probe non-critical, semi-critical, or critical instrument? According to Spalding classification, ultrasound probe can be considered non-critical if the probe come in contact with healthy, intact skin. Looks like transabdominal ultrasound, while the skin is healthy and intact. In this case, as a minimum, need low-level disinfection. Just cleaning with tissue and remove the gel, it is not decontamination. No, we need a minimum low-level disinfection using low-level disinfection swipe and must be labeled as tuberculoside, means remove TB bacilli. Also, ultrasound probe can be considered as semi-critical according to Spalding classification. How it will be semi-critical? If probe come in contact with mucous membrane or non-intact skin Example, when we do transvaginal ultrasound for gynecological pathology or for folliculometry, here the probe come in contact with mucous membrane of vagina. Or if we do transabdominal scan with patient with skin rashes, in this case, the probe considered as semi-critical instrument, requiring minimum high-level disinfection. It is important to remember that according to Spalding classification, ultrasound probe can also be considered as critical. When it is critical device if the probe come in contact with sterile tissue. Looks like using transvaginal ultrasound for egg retrieval in IVF pregnancy, or ultrasound-guided aspiration of ovarian cyst, for example, or ultrasound-guided tissue biopsy. Here, the ultrasound come in direct or indirect contact with sterile tissue inside the body. Minimum high-level disinfection or the best sterilization is mandatory in this case.
So, my daddy, it is all of the above.
Yes, Lara, you are correct. Ultrasound is all of the above. It can be non-critical or semi-critical or critical. And if you have a look for this slide, you can see different uses of ultrasound, and according to the use, we can divide it according to Spalding classification. In our gyne unit, we are using tri-still wipe systems for ultrasound decontamination. The tri-still tri-wipe system came with 3 wipes. Wipe number 1, it is more or less orange in color for pre-cleaning of the probe. Wipe number 2, tri-style. This wipe will be mixed with the activator foam, and it is used as decontamination active gradient. And the third wipe, its color is more or less green, called rinse wipe for cleaning after decontamination process. Tri-steel depend on the release of chlorine dioxide, which is effective in just 30 seconds against all microorganisms of concern, such as hepatitis B, hepatitis C, HIV, TB, staph, Pseudomonas, Escherichia coli. It is important to mention that every wipe on its back, there is documentation about lot number, LOT number, and expired date, and the set came with documentation audit book to document the process of decontamination, as we will mention later on. In addition to, there is online application. We can trace our decontamination process using this application. If I am allowed, I will speak about the second part of my introduction. After I discussed the decontamination, I need to discuss the importance of documentation. So, documentation of decontamination process. Documentation is very important and must be considered as a priority in our work. Adequate documentation is very important, as it is essential for high-quality patient care, essential for proper communication of medical information, essential for preventing adverse medical consequences, and for medical legal aspect and of course for clinical audit looks like our audit now. In our unit, where we are using the tri-steel trio wipes, there is documentation book available with the set. This documentation book, called the record book, it is used in our audit to document the data and for edit the standardized level of this documented data. I will go with you through this book. As you see in this slide, every page of the book divided into 4 main parts where we can document our data. In this section, we will find the part for the serial number of used instrument, for example, transvaginal ultrasound or transabdominal ultrasound, and we'll find the area we can document the date of ultrasound, when we did the ultrasound, and the time. So it is important to document the device, document the date, and the time where the scan was done. On this section of the record book, we will find area where we can record patient data, patient name, hospital number, date of birth of the patient, and the address, where we can put a addressogram containing all of this data in confidential manner. The section of the record book, we will find the area to document decontamination process, data of the pre-clean wipe, which is orange in color, will be recorded. It will inform the lot number and the expired date number. While the sporicidal wipe, we will put a sticker. This sticker contains the lot number of the wipe and the expired date of the wipe. And for the third rinse wipe, which is green in color, we will write the lot number of this wipe and the expired date. So in this item, we must record 6 items: lot number, expired date for wipe number 1, wipe number 2, wipe number 3. It is important to mention in the patient notes itself, we must put the same data and the sticker on the patient notes. So it is documentation that we did scan and we did proper decontamination. So this data must be in the record book, and another copy, original copy, must be in the patient notes. And this is very important medico-legal later on. The last section of record book, we will find the section to document the name and the signature for the person who performed the ultrasound. The name must be full and must be printed in capitals, full name, in addition to the signature. Again, this is a panoramic view for the record book, date and the time and type of device used, patient data, decontamination process data, and name signature of the person who performed the ultrasound. From this book, we're collecting our data about how accurate documentation and this data was compared to the standard and from this point, we can evaluate our level of clinical practice in comparison to the gold standard, and from this point, the audit will be started, as I will discuss after a few minutes. In our audit, we selected the standard, and the evidence measured against is the Health Service Executive Guidance for decontamination of semi-critical ultrasound probes, semi-invasive and non-invasive ultrasound probes, published in 2017. It is national guideline, and according to the standards, our target to get the standard target is 100% for documentation. Method of our audit, it was retrospective review for 200 patient records, review for documentation of certain items. The data was collected in Performa. As you see, this Performa include patient ID, time and date, operator name, operator signature, step 1 disinfection, step 2 disinfection, step 3 disinfection. For every item, we document if this documented or non-documented or not applicable. The data was analyzed with Microsoft Excel. The result of our audit will be discussed. Now, I will discuss the results of our clinical audit. I will discuss the accuracy of our documentation regarding patient identification, date and the time, decontamination process, and operator identification. And we will compare our result to the gold standard and the target to be 100% documentation. Our closing audit cycle was done in 2021. I will compare the result to the initial audit 2016 and to the re-audit result in 2017. Results of accuracy of documentation, clinical audit. Patient identification documentation. In our audit 2016, 57% patient identification was documented. In re-audit 2017, 100% of patients' identification was documented, while in 2021 closing audit cycle, 81% only of patient identification was documented. Results of accuracy of documentation, clinical audit. Regarding date and the time documentation, in the initial audit 2016, 96% of date was documented, 100% was documented in re-audit 2017, and On the closing audit cycle in 2021, 93% of the date of the ultrasound was documented, so 7% was not documented. Regarding the time documentation, in the initial audit 2016, 96% of the time of the ultrasound was documented, 100% in re-audit 2017 was documented, and 88% only of the time of ultrasound was documented during closing audit cycle in 2021. Results of accuracy of documentation, clinical audit. Regarding non-documentation of step 1 of decontamination process, step 1, lot number, the non-documented data regarding lot 1 in 2016 was 8%, while it was 0% non-documentation of step 1 lot number in 2017. 2021 closing audit cycle, non-documentation of lot number step 1 was 3%. 7% in step 1 expire date was not documented in audit 2016. 0% was not documented in step 1 expired date in 2017. 12.5% non-documented step 1 expired date in 2021 closing audit cycle. If I go to non-documentation step 2 of decontamination process, in 2016, documentation of step 2 lot number, it was 2%, 0% non-documentation in re-audit 2017 for step 2 lot number, and 0.5% non-documented in 2021 closing audit cycle for step 2 lot number. Step 2 expired date non-documentation in 2016 4%, 0% non-documentation in 2017, while in closing audit cycle 2021 0.5% for step 2 expired date was not documented. I will move to non-documentation step 3 of decontamination. Step 3 lot number 4% was not documented 2016, 0% non-document in 2017, 2% non-document step 3 lot number 2021. Step 3 expired date was not documented in 4% 2016, 0% non-documentation in 2017, and 13% non-documentation step 3 expired date closing audit cycle 2021. Results of accuracy of documentation, clinical audit. Regarding non-documentation of operator ID, in the initial audit 2016, the full name of operator was missed in 23% of cases and 0% in 2017, while in closing audit cycle 2021, 64% non-documentation for the person who did the scan, and this is risky figure. Regarding signature, it was not written in 13% during audit 2016, while 0% regarding re-audit 27%, re-audit in 2017, and in closing audit cycle 2021, 12% non-documentation for the signature of the person who performed the ultrasound. So, I can summarize the result of accuracy of documentation for closing audit cycle 2021 on the next figure. This figure, we can see the result of our re-audit closing audit cycle 2021 for 200 cases. All the blue color represent the documented items. The orange color represent the non-documented element. Our target to let and render all in blue color and none in orange color means all items must be documented 100%. And of course, all our work must be confidential and follow data protections rules. After we had the result, analyzed it, the next step to ask and analyze why we are still below the target. So, audit meeting was done. Why you are still below the target? We take the answers from all the personnel involved in decontamination of ultrasound probe and documentation. Some say, I see that documentation is not important. Some mentioned, I see that decontamination's not important. Some mentioned, we are so busy to write. It is a boring process, handwriting. Mentioned say, why handwriting? We need digital application. Some ask, is there any protocol for documentation? So we collect all of this and try to do deep root analysis and try to put clear protocol to increase our adherence for the standard protocol for documentation of decontamination process. So our action plan was presentation of audit result, development of many guidelines to be included in orientation package for new doctors and all gynecological staff every 4 months to include both career and GP senior house officers, continuous education program about the importance of full documentation, consultants' involvement in supervision of quality of records documentation on a random basis on the gyne world round, and of course, online courses. I would like finally to say that it is not only the matter of documentation of the decontamination process, but also decontamination of the documentation process is important. Take work message. If it was not documented, it was not done. اللهم اغفر لي ولوالدي ولأصحاب الحقوق علي وللمسلمين والمسلمات والمؤمنين والمؤمنات الأحياء منهم والأموات. فضلا نسألكم الدعاء لأبي وأمي رحمة الله عليهما، غفر الله لهما ولأمة سيدنا محمد أجمعين. Special thanks to Mrs. Onya Sylvian, Clinical Audit Manager, for her continuous help and great effort during preparation of that audit.
Salam alaikum. Thank you. Please be safe.